What's going on, everybody? 𝘱𝘠𝘧𝘭𝘢𝘪, Functional Medicine, located here inside of the Medicine Man's Corner in Albany, Georgia. So today I wanted to hop on and talk about CIRS again, Chronic Inflammatory Response Syndrome. So what is CIRS? So CIRS is basically when a human being is exposed to a biotoxin. So most of the time it's mold, but can also be tick bites or Lyme disease, spider bites, COVID. Any biotoxin sets off the immune system, and then in about 25% of the population, we have a genetic defect where we cannot resolve this inflammation. So as inflammation builds and builds and builds, it starts affecting the brain. So people are often misdiagnosed with depression, anxiety, bipolar disorder, lots of mental health problems. And then it starts affecting the heart, the lungs. People have pulmonary artery hypertension. Can start affecting the joints, lots of joint pain, muscle aches, belly dysfunction, kidney problems. So it starts affecting all of the organs in our body. So about 50% of the buildings here in the United States are water damaged. So once a building gets damaged by water, mold starts to grow, and then we inhale these spores. And like I said, about 25% of the population cannot resolve this infection, so inflammation builds, and that is where CIRS comes from. So lots of my CIRS patients have been to multiple specialists, rheumatologists, cardiologists, pulmonologists, endocrinologists, and they're given very vague diagnoses and never really telling what the root cause, when the root cause is often CIRS or that unchecked inflammation. So how do you diagnose CIRS? So CIRS is a three-part diagnosis. The first part is a questionnaire. So I send this questionnaire to every single one of my patients because CIRS is so prevalent. Remember, 25% of the population has this defect, and 50% of the buildings in America are damaged. Lots of people have been exposed to COVID, tick bites also, so don't forget about those. So we do the questionnaire. If that's positive, we move to the visual contrast study. So the visual contrast study is testing that optic nerve, and it'll tell us if you're having inflammation in the optic nerve in the brain. So this visual contrast study was developed about 50 years ago, and the United States Air Force uses it for their fighter pilots to test their visual acuity. So we do the questionnaire, the visual contrast study. Those are baselines, which we'll be tracking as we work through this thing. And then one of the big things, the third part of the diagnosis, is labs. So I do not take insurance here. I'm cash pay only, but we can utilize your insurance to get these labs as they're very expensive. So basically in the labs, we're checking that HLA, which is that genetic defect. If you have certain patterns to your HLA, then that puts you at more increased risk to developing this systemic inflammation known as CIRS. We're also testing other points in your immune system to see if your inflammation is indeed upregulated. So once we have that diagnosis down, we get the baseline questionnaire, the visual contrast study, and the labs. We're going to put you on a protocol. Then as we work through this protocol, we're going to recheck the visual contrast study, see if your symptoms are improving, and then trend your lab so we can check and make sure that inflammation is going down. So your HLA or your genetics will not change, so we know that, but we can manipulate these markers to decrease based on the protocol. In the protocol, the first thing I start you on is a binder. So initially, Dr. 𝘱𝘂𝘂𝘪, he's the founder of CIRS. He's treated over 10,000 patients with CIRS. So he recommends 𝘱𝘯𝘧𝘰𝘳𝑚𝑒 and 𝘱𝑗𝑚𝑒. So these are old school cholesterol medications that are bile acid sequestrants. So they bind up bile, which binds up toxins, and then you eliminate it. So I recently took an update in CIRS course, and they've added a third binder, which is 𝘋𝘯𝘧𝑚𝑒. It's a supplement that is a lot less harsh than these prescribed medications. So my number one philosophy is do no harm. So I start most people on the 𝘋𝘯𝘧𝑚𝑒 because it's much less harsh. And then before anything, after we make the diagnosis, the first step of the protocol is removal from exposure. So I use a test called the 𝘱𝑶𝘬2. It's about $100 to $200, and it's a home test where you can test to see if your home does indeed have a high abundance of mold. If it does, there's some things we can work on and do to get this mold down in your home. Because, once again, 50% of homes are water damaged, 25% of people have this genetic predisposition to developing CIRS. So if you or a family member is struggling with these non-specific symptoms, you've been diagnosed with things that don't really tell you the root issue, you've been misdiagnosed with chronic fatigue, fibromyalgia, mental health problems, and you really want to get to the root cause of it, schedule an appointment with me. I'll drop the link down low, and I will get to know you. We'll go through all of your health history, and then we'll do the CIRS questionnaire, the visual contrast study in these labs, and we'll get to the root cause. I'm seeing some remarkable results in patients, so I look forward to helping you or a loved one. Love y'all.